Hello, and welcome to Grassroots Advocacy 101, presented by the Colorado Mental Wellness Network. In case you're unfamiliar with us, the network is a grassroots nonprofit organization based in Denver. Our motto is Be Well, Have Hope, Pass It On. And here's what that means. We're dedicated to helping individuals be well through providing wellness tools and resources. Have hope by inviting them into a supportive peer community, and pass it on by training them to be the next generation of wellness leaders and advocates. This presentation and the ones to follow will help you pass it on by giving you skills and resources to become an advocate yourself. First off, we're going to talk about what advocacy is. Advocacy, we have two definitions here: the act or process of supporting a cause or proposal, or a doctrine or practice that emphasizes direct, vigorous action. So, for example, you may act in a way that supports the cause of improving your community's mental health. These actions are directly for the cause, and they are done with enthusiasm and vigor. Enthusiasm and vigor are really key here. Advocacy is not an activity for a bystander. Now, who can become an advocate? Really, anybody can. We're all advocates. There's no established school of advocacy or degree in advocacy because no special training is required. Even small actions can make big changes, like sending a letter to a hospital director or speaking at a healthcare conference. You never know who you will influence. It's important, though, for any advocate to be really well versed on their issue. Fighting for a cause that you don't know much about isn't very effective. Becoming an expert in what you're advocating for helps you seem more credible, which ultimately it makes you more effective. And like I said before, enthusiasm and vigor, passion and dedication, these are always required to do advocacy work. Now let's talk a little bit about social activism. You might have heard this term before, but weren't really clear on what it means. Social action is the practice of taking action, usually as part of an organized group or community, to create positive change. Linked on this slide is an activist toolkit. This is a fantastic presentation about advocacy put out by an organization called the Cancer Support Community. Social activism is important because it's needed to create social change. Change usually doesn't happen if no one speaks up and says that they want change. It's important that individuals and groups make their voice heard so that people in charge of making the decisions know what people really want. Another reason why social action is so important is because it can empower and energize populations that have been traditionally powerless. The civil rights movement in the United States was a great example of this. People of color were traditionally a powerless population, but they and their allies stood up and made their voices heard until they were granted legal equality. Clicking on this link here will take you to a webpage by the Community Toolbox at the University of Kansas, and it tells you all about the skills you need to hone to be an effective social activist. Another reason to engage in social action is that it unifies communities and demonstrates that they are forces to be reckoned with. If a group in power believes that another group will simply roll over and let their own power be taken away, it makes it even easier for that group in power to take control. When communities rise up and organize around a social issue, it tells the group in power that they have to fight. It may be the only thing that will move a stubborn opponent. It's really important to note that social action needs to be peaceful. Sometimes social activists can get confrontational and combative. But doing it this way doesn't breed mutual respect and understanding, only further combativeness. Peaceful demonstrations, like story sharing, can be even more effective than browbeating and civil disobedience because they invite the other party to listen rather than priming them to fight. When you're sharing your story, it's important to use person-first language. This type of language emphasizes the person before the disability. For example, saying a person with schizophrenia instead of a schizophrenic, or people with physical disabilities instead of the handicapped. By placing the person first, the disability is no longer the primary defining characteristic of an individual. It is only one of several aspects of the whole person. So how do you actually get started in advocacy? How do you turn your passion into action? The first step is understanding how a bill becomes law in Colorado. This is important because bills emerge periodically that may help or hurt your cause, and it's important to understand how they might affect your cause if they are passed. First, the bill is introduced in the House of Representatives. The bill is read by the House Clerk and referred to committee by the Speaker of the House. There is a committee hearing and vote, which may include testimony and amendment. The bill undergoes a second hearing and voice vote, and after that, the bill undergoes a third hearing and final vote. If it completes all of these steps, it moves to the Senate. The bill is referred to committee by the Senate President. The Senate President holds another committee hearing and vote. The bill undergoes a second reading, which might include Senate debate. The bill undergoes a third reading, and if it passes, it is sent back to the House. If the bill passes back to the House unamended, then the bill is sent to the governor, who has the final say about whether the bill is passed into law. It's important to understand this process because you may wish to introduce a bill and use your testimony to get the bill passed. Using person-first language and telling your story goes a long way in convincing others to vote for your movement. Many people have not walked in the same shoes as you, so telling them your story helps them understand your perspective. Now that we've covered that, let's talk about some action steps to advocacy. The first step is finding like-minded people. In mental health advocacy, the first place to start is organizations that may already be in the process of fighting for your cause. This link here will take you to a list of mental health and disability advocacy resources to get you started. The next step is to tell that organization your story. If you feel like you and the organization would be a good team, then partner up. Voice your concerns to them and tell them your story to help them understand your perspective. After this partnership starts, the process of changing the system can begin. Contacting senators or House representatives about bills in place or bills that you want to introduce is a good next step. That's your short introduction to advocacy. But before I go, let's go over some important points to remember. 1, the first try might not always be successful, but it's important to never give up. 2, your story is the most important part of the equation, and it holds real power. Spread it and make your voice heard. Finally, it's important to remember that sharing your story to those who are in power over your situation helps them understand where you're coming from. Frankly, they might not have even thought about how their decisions impact you, but it's important to let them know. Finally, here are some resources for you going forward. Once again, this was Grassroots Advocacy 101 by the Colorado Mental Wellness Network, and I want to thank you so much for joining me. Now get out there and advocate.